Today I will be discussing with you what atrial fibrillation is. Before we begin, it's important to understand what the heart is and what its function is within the body. So the heart is an organ that's involved in delivering blood to all of the body's tissues. And blood provides the body's tissues with the oxygen and nutrients that they need to survive. So the heart is a four-chambered pump with a right side and a left side, each side having an upper atrium and a lower, more muscular ventricle. Blood enters the heart through to the atrium and begins to collect. When a sufficient amount of blood has been collected, the valves to the ventricles will open and the atria will contract, and the blood will then enter the ventricles. From the ventricles, blood will then exit the heart, and on the right side of the heart, the blood will go to the lungs. Blood will also enter the left atrium and subsequently go to the left ventricle. From the left ventricle, the blood will then leave the heart again, but this time it will go to the rest of the body. Now, for these contractions to occur, the heart relies on a number of intrinsic electrical signals that control the heart. Within the right atrium, there exists a cluster of pacemaker cells, and these cluster of pacemaker cells are called the sinus node, and they act to initiate heart contraction to ensure that the heart beats in a normal rhythm. In this animation, we can see that the electrical signals of the heart control the filling and contraction of the heart. In atrial fibrillation, there is a loss of this regular pattern of firing, and instead it's replaced with a chaotic pattern of firing, as the SA node is not the only node that's able to initiate heart contraction, and a bunch of electrical focuses are within the heart. And this causes the heart not to be able to beat in a controlled manner. And this leads to the appearance of the atria quivering, or what is known as fibrillation. Now, because of this fibrillating of the atria, a number of different health outcomes can happen. So as we said, the heart is quivering, and because of the heart beating in this irregular way, this quivering can be felt by some patients to feel as palpitations, or feeling as if your heart is fluttering in your chest or beating very quickly. As well, because with each contraction of the heart, not all of the blood is able to exit the atria, you have a decrease in your amount of blood output with each heart contraction. And as the tissues of the body are not receiving the amount of oxygen and nutrients that they require, this can lead to an overall feeling of fatigue. And finally, a very important health outcome to be aware of with atrial fibrillation is the increased risk of forming blood clots. So as the heart is not able to contract efficiently, blood may begin to collect or pool within the heart, increasing the risk of blood clot formation. And these blood clots can then exit the heart and become lodged within the vasculature of the body. And if they become lodged within the vasculature of the brain, this can lead to the formation of a stroke. And for these reasons, it's important that you follow up with your cardiologist with your treatment plan for your atrial fibrillation.